My topic today is to speak about maintenance of the alveolar process or the alveolar ridge post-extraction. Now, we see slides like this, and we all recognize quite clearly as dentists that the inevitable result of tooth extraction is resorption and dimensional alterations of the ridge. And this, we don't need studies to tell us that this happens. We see this all the time, and this is part and parcel of dentistry, and it also, particularly in the field of implant dentistry, creates issues with the management and replacement of missing teeth with implant-supported prostheses. Now, we also know that as a basic principle of implant therapy that we need to maintain adequate bone wall thickness around the implant. So an implant needs to be completely surrounded in bone in its entire circumference and its entire periphery. Here's an example of a maxillary anterior site, and here's an example of a mandibular posterior site where the ridges are thin after the preparation of the osteotomy. We know clearly that if we do not adhere to these basic principles, then there are consequences. There is a biological price to be paid for not adhering to those principles. Here is an example of an implant placed into a region where there is lack of bone volume. We have the implant in a malposition. We also have soft tissue-related issues. Again, we understand this and we know this. But we also know that if implants are placed into narrow alveolar processes, narrow ridges, then this can overstress the bone so that over a period of time, we can lose some of the bone walls that are thin by processes of resorption. This then exposes the implant surface to a biofilm contamination and can then predispose the site to developing peri-implantitis.